Hello everybody, and welcome to today's webinar on how to differentiate your agency overnight. Excuse me. We're going to go ahead and get things started. I'm going to leave this screen up for just another minute or so, as we may have some stragglers joining us here, and just want to make sure that they've got the information on how to get the audio for the webinar. I've got Nick Vistano on the webinar with me today as well. He's kind of monitoring the question and answer and chat box as we go throughout the webinar. So if you've got any kind of technical difficulties, please let Nick know, especially if you're having trouble hearing me. Anything like that, you can type a message there to Nick in that chat box or the question and answer box. Speaking of that, as you're thinking of your questions as we're going along, go ahead and type those in, and then when we finish the presentation up today, we will have a live question and answer session. So for those of you who don't know me, I'm Chris Giles. I am a sales associate here at TAG Home Care Marketing. TAG is a leading producer of marketing products for the home care industry. We are an Inc. 5000 company, one of America's fastest growing companies, and we're located in Franklin, Tennessee, which is right outside of Nashville. I have a tremendous support staff built around me here at TAG. I'm backed up by home care sales coaches that have extensive skilled home health, nursing, therapy, hospice, and private duty marketing experience and sales experience. But we also employ some of the brightest and most talented graphic designers, web designers, master printers, and copywriters in the business. Plus, we also are a high-end publishing firm. We've got over $10 million worth of state-of-the-art printing equipment at your disposal. Together, we pull from over 30 years of home care experience to create proven marketing products and services that are going to help you as an agency grow your referrals. Just to give you an example, some of our products and services include sales and marketing coaching, like I mentioned, customer relationship management software. We have tons of done-for-you personalized marketing collateral, up-to-date clinical marketing assistance that we can provide you with, and a host more tools that are going to help you realize greater success. And our motto is, and what we always tell all of our home care clients, is if your agency can dream it up as a marketing strategy, we can certainly make it happen for you. On today's presentation, I'm going to show you step by step how you can differentiate your agency from the competition by using community education classes. Positioning your agency as a healthcare community resource for valuable referral sources has become more important than ever in today's competitive home care market. We see everybody on both ends of the spectrum, established agencies and startups alike, that are struggling with separating themselves from the pack by using what we call Me Too marketing techniques. And Me Too marketing, that's basically a variation of your competitors' general service brochures coupled with some cookies or some lunch on a sales call. And you can probably go into any referral source there in your market, and they'll pull out their big collection of brochures from local service providers. And everybody's pretty much says the same thing. More often than not, what you see happening is your referral sources, they eat up the cookies or lunch and forget your agency and the great services that you are providing today. So let's take a better approach. It might be a better idea to directly brand yourself to those clients who you've spent a ton of time and a ton of money to attract. And what I want to emphasize as we're going through this today is the importance of getting to the client early in the healthcare continuum before they're in that acute setting. Because once they're touched by the acute setting, your competition is going to skyrocket. Home care companies today have got a wonderful opportunity to increase their referrals by doing direct-to-consumer marketing to seniors. If we just look at some of the numbers here, in 2011, more than 8,000 people will turn 65 each day. And the senior population in the U.S. is projected to reach almost 49 million by the end of the year. This is according to the National Private Duty Association. So now, as home care agencies, you're tasked with not only providing services to this extremely growing, aging population, but also distinguishing your agency services to these seniors and the third-party referral sources. What makes you different? What makes you unique? To attract the senior audience, home care agencies have got to understand the senior market, the dynamics, and certainly the senior psyche. And the agencies that do that will be the progressive and successful ones of tomorrow. There's also a real distinct advantage in home care sales in that all home care is local. All you have to do is saturate and brand your agency within your local customer base. I think you'll certainly be shocked at how cost-effective it is to accomplish this, but also once you've branded your agency with that unique selling point and message, you can start building the foundation of referral relationships. When we talk about clinical referral sources, they're being blown up every day by home care salespeople, bombarded with sales calls from home care agencies. And essentially what happens is everybody's following the same script with the same pitches. We love your mama like she's our mama. And although more times than not, that's a very true statement. With the care you provide, everybody's saying it. Rarely are there new ideas or distinguishing factors that will persuade these referral sources. So now they're putting up the wall. They're becoming increasingly guarded and hard to reach. And so those good old days of showing up at the hospital, dropping off some brownies and brochures, they're done. They're over. Getting access now to decision makers in the clinical referral settings has become a very, very daunting task. And once accomplished, it often still results in the Me Too type of sales call. And, you know, we all wish we could arrive at the referral sources with all of our compassions there in a bucket and they would buy that. But we can't. The environment we sell into for referral sources is the red ocean environment, which is part of the blue ocean strategy. If you haven't heard of the blue ocean strategy, there is no permanently excellent industry. One of the driving factors in our industry that's keeping us all from sustaining the permanent excellent growth is competition. So competitors who just compete against one another with the Me Too marketing tactics are essentially just fighting it out in the red ocean. They are bloodying up the water, so to speak. So that progressive company of tomorrow has to develop a new strategy to create a blue ocean that is above all the competitors, or it's outside the normal arena where others are competing. So it all goes back to differentiating and a unique selling proposition. And I want to give you one example of this before we move on. Back in 1984, there was a little car company by the name of Chrysler. I'm sure some of you guys have heard of that. And they were on the verge of bankruptcy. Barack wasn't there to bail them out. He was hanging out in Hawaii, hiding his birth certificate so Donald Trump couldn't find it. So they were in big trouble. They had to do something to create that blue ocean strategy because they were drowning in the red ocean. What they decided to do was break the boundary between car and van, creating an entirely new type of vehicle. It was going to be smaller than the traditional van and more spacious than the station wagon. Exactly what the average family needed to haul everybody around town, plus the bikes and the dogs. And what was that they created? It was the minivan, of course. So once Chrysler created the minivan, within the first year, it became Chrysler's best-selling vehicle, helping the company regain its position as one of the big three. Within 3 years, Chrysler gained $1.5 billion from the minivan's introduction alone, not to mention ruined 2 years of my high school career as my parents passed along the Chrysler Voyager to me once I turned 16. I sideswiped the guy on the interstate, though, and that put a kibosh on the minivan, so that was a pretty good strategy on my part. Going back to home care now, I was thinking about me driving the minivan. It brought back some pretty bad experiences. So we go back to home care now. Let's refocus. Often the best type of contact with these referral sources is from the bottom up. It is where private duty will find their customers earlier, where home health agencies are going to outmaneuver clinical referral sources with patients stating choice. And it is a way to get out the longevity of palliative life and quality of life indexes for hospice. What we're doing is reaching their client base before the point of discharge or recognition of the need of your services. And as you can see, what I've got up here on the screen now is some great news for all of us. We've already got some good ROI that this works in the healthcare setting. The pharmaceutical companies have busted the door down with straight-to-consumer marketing of healthcare. So if we look at this on the screen, drug companies spend $4 billion a year on ads to consumers. In 1997, the FDA rules governing pharmaceutical advertising changed, and now companies can name both the drug and what it's for while only naming the most significant potential side effects. And that's when the number of ads exploded. The Nielsen Company estimates that there's an average of 80 drug ads every hour of every day on American televisions. And those ads are clearly producing results, so they wouldn't spend like that. Prescription drug spending is the third most expensive cost in our healthcare system. And it just seems to grow larger and larger every year. Last year, the average American got 12 prescriptions a year as compared to 92 when they only got an average of 7 prescriptions. In the last decade and a half, the use of prescription medication has gone up 71%. So I don't think that there's any chance we're ever going to see those drug companies blowing up the doctor's offices like it was 10 years ago. They have discovered that secret to direct-to-consumer marketing, and they've opened the door for us. And actually, you know, the old argument that, well, marketing to the public doesn't work with the home care business because you need a doctor's order, in some cases it doesn't hold water anymore. The doctors are writing all these prescriptions for the medications, but they're doing this at the consumer's request. I mean, what do you hear before the tagline of every drug ad? Ask your doctor about it. Ask your doctor about it. Plus, again, going back to what I mentioned earlier, with Medicare home health, nothing ever trumps a patient's preference at the point of being discharged, and that is the most important thing here. So let's switch now. I want to switch focus to your agency and just ask you a couple of questions here. And I probably know the answer to all of these, but do you want to make more money? Does constantly promoting your agency, sometimes it makes you uncomfortable? Or let's take that a step further. Maybe you're just getting frustrated and uncomfortable that your message is getting lost in translation, or you're constantly preaching the same sermon and nobody's buying from you. Nobody's buying the message. Do you want to attract new clients with integrity, simply maybe without selling? Do you want to distinguish your agency in your territory as being the unique service provider? And most importantly, do you want to grow your business? I probably got a big Charlie Sheen duh from all of those questions, but just to keep in mind. One of the universal truths about consumers is that they hate to be sold to, but they love to be informed about your services. The technique involved in home care service selling is a form of the soft sell. More and more companies are using soft sell marketing, especially when marketing a non-tangible item like a care service. So with the soft sell approach, you're providing an educational message on a consistent basis. So when that care need comes up, when it arises, you're the agency that's top of mind with the person or family in need, and there's no hesitation on their part either to choose your agency because you've established yourself. You're the expert through educational messages on health and safety, issues of aging, and just general senior information. Soft selling certainly relies on developing a relationship with the prospect. Rather than just sitting there pounding away at why somebody should buy from you, soft selling requires you to take a less pressurized approach. In the hurried world we live in today, consumers are impressed when you take time to get to know them. Educating the consumers in your specific coverage area is such a great way to promote your agency services. Nothing you can ever relay in print or any other advertising will have the same impact on an individual as a live presentation. So the growth of referrals through soft selling is a beautiful thing. It's being able to speak to a potential referral group with a new message that's setting you apart from your competitors in any market out there. And I'm not really saying anything brand new to you today. I mean, most of us have all thought about giving a presentation as a marketing strategy, but here's the problem. We never have time to develop the programs and put all the necessary components together to make it an effective presentation. A lot of times what happens is we try to get this started, usually spend about 4 to 6 weeks on a topic, do it once, and never really benefit from the true value of branding our agency and its representatives as community educators. You spent so much time creating that first educational presentation that it just wasn't worth it to do that again and to have that much office time taken up every day. And some of you, on the flip side of that, may have sales reps who are constantly in the planning stage. And I put finger quotes around the planning stage for those of you who can't see me, which is all of you. The planning stage refers to the rep at your agency who's constantly in the office mapping out what they're going to do, or they're still just sitting in there creating the materials in order to avoid actually pounding the pavement and selling. It's plain and simple. And it's sometimes a hard truth to realize, but that could be, a big problem as well. And I want to go back to the Chrysler example from earlier, because when we talk about implementation and certainly branding and taking advantage of a new blue ocean strategy, Chrysler was not the first to work on the minivan concept. Ford and GM had the minivan on their drawing boards for years, but they were caught up and worried that the minivan was basically going to kill out their own station wagon. So undoubtedly, they passed on a golden opportunity that they gave to Chrysler. When you translate that over into the home care agency, it is all about implementation, and it's all about doing it on a regular basis. When we go back to branding, it should be a natural byproduct of your current marketing efforts. So in order to establish your agency as the community education resource, it's crucial to provide that educational message on a regular basis to your audience to establish that brand awareness to them. So as you are out there, you're doing the presentations to seniors on a monthly basis, those third-party referral sources start to take notice. Those organizations that have allowed you in to present view you as a value-added partner, and you gain that trust, both from the senior and from the referral source, which is so important to have. In the bulk of today's presentation, I'm going to explain the effectiveness of live presentations. We'll look at who needs your services, where you can go to get a standing appointment each month, where are these presentation venues, the components of an effective series, what you need to have in place to get the message across to your client. This is very important, again, in the implementation phase of an education program, because they're the actual materials that you have to create. But with the education series, we've done that for you. There is no downtime creating any of the materials, so you can focus on the more important thing, getting those appointments set with local groups and the actual presentations. Turning your presentations into sales, the end goal, right? How to achieve the highest return on investment. And then networking with live presentation. Having an audience of consumers on a regular basis is very, very attractive to other third-party providers, and it can certainly be used as a unique selling proposition for your agency. The key to growing your referrals is to have your agency's name and brand in the community, for your name to be on the tip of the tongue of somebody that might need your services. If you're out there leading the way and differentiating yourself in the marketplace by offering an educational series, you're showing your agency's dedication to the senior community. You're branding yourself by leading the way and making sure that seniors have got the tools they need to be informed and knowledgeable. Then you're seen as that community resource for seniors, and therefore becoming a partner with every facility in which you teach the series. Since the greatest percentage of the communication process is physical, live presentations are emphasizing personal delivery styles and the mechanics of presenting. You have eye contact. That's enhancing your personal effectiveness and your style. And you're able to emote that important element of trust when using the live presentations and interacting with your audience. If we look at some recent brain mapping studies, they concluded that the most effective way to present to the elderly populations is using live presenters, because it allows for different areas of the brain to be stimulated at once, through sight, through sound, and through emotions. When we talk about presentation venues, marketing your education series to residential communities should be one of your highest priorities. In these settings, you will have hundreds of potential referrals to approach in your market. The need for activities, that's in this setting, in the ALF, the need for activities, that's kind of lending yourself to productive marketing visits, a way in, if you will, the foot in the door. In residential communities, activities are like gold. If you go into an ALF, they've got these huge calendars, bingos on there, trip to the mall, amateur comedy hour with local resident Ray Johnson. So if you can provide that activity director, who is usually the most beat-up person in that facility, an option to provide a health and safety class, you're going to be their hero. Your best bet is to go through the activities department, approach through there, because they need your service. Marketing your services to them is going to lend an easy way to set that presentation up. Other presentation venues, or where else there's a current need, disease support groups are also a group of consumers who need education as activities. National groups such as the Alzheimer's Association and the American Cancer Society, along with local respite, they usually meet monthly and would love to have general senior specific health classes. You can certainly try teaching a health class at a local church or senior group. Big opportunity there. If you look at the evangelical churches now, a lot of the larger ones have made a split. So they have the traditional services and the contemporary services, and that's created a little bit of resentment in the church. So they're a great referral source for you, because you could make an appointment and say, guess what, I've got something for your senior population. I can do it every month. So you'll brand yourself with them, and these groups are usually very receptive to the information and the benefits. Local civic and charity groups like the Lions Club, the Red Hat Society usually have speaker lists where you can sign up to teach and give live presentations. Another place you may want to check out, local parks and recreation departments schedule senior education classes there, local public libraries and meeting spaces. So now I want to take you through the actual components of our Health Matters education series. What we're looking up here, this is the pop-up screen. Now, usually when you're invited in to present, and maybe you're doing it out at the Golden Corral or a restaurant or in an activity center, they're going to put you in the back parlor. And this is going to be up there along with your beautiful mug to reinforce who you're with. A lot of times when we were testing these presentations, what would happen was at the end, some seniors would approach a presenter and say, "Oh, Chris, this was such a great presentation. I really, really enjoyed it. Now, who are you with again?" So this kind of reinforces and starts that branding for your agency with the pop-up screen here. Of course, you need an instructor guide that is informative, but also that's written in conversational language that your audience will understand. It should contain useful information and reminders of health and safety guidelines. And the guide should approach the seniors with an open and informative dialogue that encourages participation and discussion. A lot of times I get the question, especially on the private duty side, "Well, Chris, what if I get a clinical question? What am I supposed to do about that?" Well, if you have a clinician in your office, all you have to do is say to the senior asking the question, "If you call this number, I'm sure someone will be able to answer that question for you." Or better yet, at the back of every one of our instructor guides is a day planner. You write the person's name down, make sure they see you writing their name down, and say, "You know what, when I come back here on May 26th, I'll have your answer for you." The next component are the class flyers. Now, you will need class flyers that follow along with the subject and instructor guide's text. You want to make them colorful and on topic with large fonts, and they're easily read by senior audiences. The flyers should have your contact information and logo prominently displayed, as these are going to serve as your leave-behind collateral. And let me expand a bit on the collateral overall and just the overall design that you're seeing with our education series. Like I mentioned earlier, we did pilot this program. We did multiple test runs in an actual home care setting with the education series that you're seeing here today. We did this before we released the product. So for the design, we started off with real photos of seniors and senior settings with text. Then we tested out another one where we did heavy big font. And then we did the version with the cartoon characters you see on the screen right now. We always ran out of the flyers with the cartoon characters, and honestly, these became collector's items with the seniors. That is exactly the type of branding and name recognition we wanted, and every agency, I'm sure, would love to have with their senior consumers. So with the Leave Behind materials, we ran with the current design that you're seeing here on the screen now. Adding colorful upcoming class posters help serve as a billboard of your company's products and services even when you're not there. So you put these posters up in the churches, the ALFs, the ILFs, all types of the facilities, and what you do every month when you come back, you've got a new topic that you were doing next month. So, for example, this month we're doing making the most out of your doctor's visits, and next month we're going to do understanding allergy. Well, you replace that with the new one right here, the understanding allergies, and again, you've got that year-round billboard. Your logo's there. Your contact information is in that facility year-round. Now, as an added value measure, printing colorful postcards that you can mail to every past, present, and potential referral source that's located in your market can be very helpful because it tells them who you are and what your company is doing for the senior population in the community. Now, your third-party referral sources, they're not necessarily going to attend your presentation, but I really love these because I think it can also very easily turn a cold call into a warm call with that referral source, because when you send these out to a potential referral source, like I said, it's probably highly unlikely they're going to attend your live presentation. But they do take notice of what you're doing for the community, especially after they start to receive these from you on a regular basis. Well, the next time your sales rep goes in for an on-site visit, they can take a postcard with them. Hey, I'm Chris. I'm from ABC Home Care. We do the Health Matters Education Series. Oh, yeah, Chris, we get your postcards every month. My son likes to color on them when he comes in and works with me. But, again, you're reinforcing that message of what you're doing in the community to these third-party referral sources, and they're starting to take notice. Now, you'll also need to have a printed brochure listing all the benefits to senior groups. These will serve to explain to the decision makers the purpose of your education series, and they may be needed for multi-person approvals. So this is going to be the leave behind with the decision makers right here. It's also a way to back up your sales message, because words are forgotten, right? And it's a way to reinforce your soft sell message, to show that the element, or to show that you're providing value to their senior group. You're not just going to show up and essentially give a live infomercial of your home health agency for 30 minutes. This helps reinforce that soft sell message to the decision makers of these facilities. Excuse me. And the final piece of the puzzle, the most important component of the education series, is our marketing guide. I say that because this is your blueprint of how you sell the education series to the different organizations in your community. We give you a step-by-step guide here of how to approach each organization and what you need to do to be successful in getting that standing appointment. I talked to you earlier about how we did a large test run before releasing. Well, in a nutshell, this is your case study for best practices in selling the series, broken down by the different organizations and how to approach each. Who are the power brokers or decision makers in each organization? Why you need to approach the church secretary and not the pastor in religious organizations. We talked earlier about having huge success rate selling to the activities director and not the administrator in the ALF settings. In addition here, we also provide you with some ready-to-go advertising templates and press release templates just to help you further increase awareness of your education program within the community. A series of ads could serve as a great static marketing message in local newspapers, print ads. Some classes that are done for 501c groups can afford you free publicity through public service announcements. So as we look at all of these, what I mentioned again in the beginning is that it's done for you in turnkey. So we want you to know that when we say that, we truly mean that. So now the question is, how do you turn these presentations into sales? With some forethought, you can turn presentations into direct community referrals. One thing you might do, try taking along a nurse or a therapist to some presentations that are condition appropriate. Adding challenge statements at the end of your presentations to the community and the church groups are a great way to go. Example of that would be, you all look blessed and are really in great shape. However, I know most of you probably know one or two people who may be able to benefit from our services. I'm going to write the name down of one of our nurses on your flyer, so feel free to pass that along. Another one you could possibly use, if you know one or two people who may be able to benefit from our services, I've got three of my business cards left up here in my wallet, so I'd be happy to pass along my contact information to you so you could give to them. And then when you got 15 people coming up to the front of the room to get a business card, you go out to your car and you grab that huge stack of business cards that you got in your trunk. While you're doing these presentations and you're going direct to the senior, that relationship with the actual facility starts to develop and grow. So one of the things you can do when you're in that ALF, schedule an appointment with the administrator of all the assisted living facilities to discuss one of their major problems, the loss of residents to skilled nursing facilities and long-term care. And I want to give you a great real-world example of this. We had an agency in Texas taught the Health Matters Education Series in a large upscale ALF right outside of Dallas. Now, they had never provided any business before, but the customer followed the marketing plan, and it went through the activity director to get that standing presentation and began teaching. After teaching the classes a couple of times, she approached that administrator and discussed the problem the administrator was having with losing residents to skilled nursing facilities after hospital stays or even doctor's visits. So in the end, and I'd like to show you an example of this, if you'll just give me a second to pop it up on the screen. In the end, an ALF management of care flyer was placed with the resident's face sheet when the residents went to the hospital or physician. That flyer reminded the physician at the point of discharge that one-on-one supervision and care was available in that ALF through the private duty agency. So it was really a win-win for both there. As you brand your sales staff as a value-added educator of seniors in the community, your agency is going to make valuable contacts. Never underestimate the power of butts in seats, or in our case, wrinkled butts in seats. Some of your adjunct home care providers, they're going to need the wrinkled butts that you've attracted. So start networking, building third-party references by sharing your audience and targeted providers such as DME, hospice, and medical practice offices. There's going to be opportunities that will arise to be a speaker at planned events hosted by facilities and charity groups. So with the Health Matters education topics, you're adding value to the event and also to you as a presenter. Those right there should be the cornerstone of a planned topic discussion that's going to include your company but also a description of its services. Branding your company is vital to your success, especially when we're talking about a care need. The community as a whole does not think of home care until they need it. If you are offering educational presentations at no charge, participating in other senior activities, and also offering that compassionate care for seniors, which I know all you do, your name is going to be mentioned when a new client is faced with looking for care. The Health Matters Education Series is written by clinicians and therapists and approved by physicians to be given by non-clinicians. They're all written at a 9th grade learning level with the senior in mind. Nothing in your Health Matters Education Series is controversial or dated. Again, it's designed to be presented by the non-clinician marketers with any questions that may come up at the end to be directed to your clinical in-house staff. You know, it's always a great thing to match up your sales rep with one of your clinical team members and kind of start a mentorship. Because all of these classes are written on universal topics at a community education level, they can be taught year after year. You can keep teaching these as you go along through the years. And I do just want to go through all of the 12 topics with you, just spend a little bit of time on each. So the first one you see here, senior exercises. You can team up with a home health therapist or massage therapist on this one. It is definitely our most interactive series in the class, full of fun chair exercises and advice. Some presenters have wrapped this around a Get Fit Day. They put on the jogging suits and they go in and present, and they have everybody in attendance wear their workout clothes. And it's get some pretty awesome pictures of what the seniors show up wearing too. Chronic disease management. A lot of folks ask me, well, what's a good topic to start with? Well, I always recommend this one because it's a catch-all for seniors who take maintenance medications and who are dealing with onset diagnosis. Disease support group representatives such as the American Cancer Society and the Alzheimer's Association always love to co-present with you on this one. Cold and flu prevention. This is when the exacerbation of symptoms start to occur. It's also a good thing to team up with somebody that does flu shots for co-marketing, or maybe you're doing the flu shot clinics this year yourself. Making the most of your doctor visit. This is a very powerful presentation. You'll find the feedback you get from this one is incredible. And like we were discussing when we were looking at the instructor guide earlier, you want to make this presentation interactive and conversational. And the truth about seniors is that they love to tell stories. These folks are amateur comedians. They've got incredible backgrounds. So with the education series, you're up there as essentially a facilitator and let them get involved. You want their feedback because if you can get them opened up and get them telling those stories, that leads them to telling you what their needs are. Fall prevention, an opportunity for you to maybe show off your therapist or team up with a therapy group. You can even provide the gait and balance screenings on site. For heart health, obviously a wonderful presentation to do in February as it is National Heart Health Month. It's also a hit with the seniors who are taking the heart medications, and they've got tons of questions there for your clinical staff. For Exercise Your Brain, this is a natural for facilities with memory care units and adult daycares. This one we've seen has been a great hit with the civic groups, like the Red Hat Society. It's a great time to pass out puzzle books or crosswords, Sudoku, seek and find puzzles, and make sure that you've got your agency branding and contact information on those as well. Sensory changes as we age. This is probably our most effective class given in the communities. In layman's terms, it explains what changes are the normal part of aging and what symptoms need attention and are preventable regardless of age. Sometimes seniors are living with conditions that are preventable. For the eating game, diet and nutrition covers the diet most beneficial to seniors as they age and covers healthy eating options. It's a great class to bring in a local hospital dietitian or to provide a healthy senior luncheon right there at the Independent Living Center while you're giving the presentation. Understanding allergies tackles the growing problems communities have with allergies. It has certainly been co-presented with a local allergist physician, and that has been a huge hit. With muscle, bone, and joint health, you can bring in representatives from your local rheumatologist office and cover ways to alleviate the discomfort and treatments and preventative measures. This also explains osteoporosis and why this is a potential serious condition for seniors. Some of our clients have also done ankle bone density screenings along with their class. And then finally, understanding medications. And as you've seen as I've gone through, there's no bad topics to teach. And with this one, this is one of our fastest seller. And this could honestly be taught to your staff even. It covers common over-the-counter drugs and talks about the correct dosages to obtain optimum results. We've got a general practitioner who has this instructor guide in the lobby of his waiting room along with the class flyers as giveaways. Once you're in presenting to church groups, the civic groups, the skilled nursing, and the ALFs, I mentioned in the beginning we have home care coaches here, and they can help you and instruct you on how to really take this marketing technique up another level, especially in the networking aspect of it. An example of this would be forming quarterly pastoral brunches or senior lunches or speaking seminars. We touched on an example earlier of how the education series has helped home health agencies. So I do want to talk to you real quick about other ways it's helped hospice and private duty. And the sky is the limit when you talk about going to the next level on the networking side. One of our agency partners in the senior seminar was a hospice group out of Beaufort, South Carolina. They had met their clinical supervisor and marketer before, but chose them for the event based solely on their census. They asked the marketer what they thought was an obvious question. Well, how do you market to religious leaders in the community? And they were pretty shocked by the answer because the answer was they had never marketed to them. So this set out on a pretty big brainstorm in our strategy plan, and they spent the next 4 days calling on every pastor, minister, and church secretary in the county. They had an idea to use the education series as a cornerstone in reaching out to the religious community with a pastoral breakfast. It was going to be a quarterly breakfast provided to the church community guests where anyone could teach the education series. And then the next idea or next step was to go to the assisted living facility that had joined them at the senior seminar and ask them to host a breakfast. Surprise, surprise, their marketer jumped at the chance to give a tour to a group that represented so much referral potential for them. They provided the food, they provided the meeting place, and at the next Low Country Healthcare Network group, the agency was approached by the marketers of 3 other facilities wanting to know why they hadn't chosen them. In that same day, they were also approached by the largest home health provider in the market asking to be a guest speaker at the next pastoral breakfast. So you can see how it's a beginning of a great program and a way you can take that to the next level, especially when you talk about networking. And once you have that group of seniors, those wrinkled butts in seats, as I so lovingly refer to them as, it's very valuable to you. That is a unique selling proposition for your agency because you will have other healthcare associations that will want to team up with you. With this group, I think one of their latest guest speakers was from the Department of Health and Human Resources, explaining the benefits of Medicare to the area religious leaders. The hospice group publishes the itinerary and acts as the host each quarter, and their census right now is at an all-time high. We've got another client in Florida who is paid by the states to teach our Spanish language education series. I know looking at some of the questions here on the box, there was a question about if these materials are available in Spanish, and they are. And this was actually set up through a state grant to teach health and safety topics to residents who have language barriers. He gets a ton of referrals from these. We have a client in Indiana who's part of his local city government senior program, and he's the expert. He is their health and safety instructor, and that's actually led to him having his own column in their newsletter, which is a distribution of over 20,000 every quarter. There's a client in Pennsylvania now who has got essentially a regular spot on a radio program, and she is using the Health Matters Education Series topics and information as her presentation material when she goes on the radio show. So there is a ton of third-party referral cloud and influence in your territory. And I think what you'll find is simply being able to call on that 60 to 100 seniors and other community members to attend health fairs, speaking engagements, charity events, you'll really start to brand yourself as an instructor and develop that audience, that regular audience that you have. And other third parties will need that following, and they'll want to attend your events and to team up with you for other events. Now, I'm almost to the end of the presentation today. I can send you samples of any components you would like to see. If you have listened today and you're ready to begin creating that blue ocean in your territory, or maybe your sales staff they're just all over the place. They're using the shotgun approach right now, and you want to get them grounded and on the path to a focused and sales marketing effort where they can't throw out any more excuses about, well, I'm still putting my presentation together, but I'll get out there soon and get some appointments. I do have an exclusive offer that I can offer to everybody who's on the webinar presentation today. I will get to that in just one second, but just to show you some pricing here. This is our startup kit, broken down by what all is included and the quantity on that. You can have the option of going month to month with the different topics, or you can buy them in bulk. One of the offers that I have today is with the 12-topic package, which it's listed on here as 11, but that's 11 plus the startup kit. I can actually offer that to you for the 8-topic package price today. Once you reorder, this is what is included as far as the items and the quantity associated with that. So when you're ready to do your next topic, this is what we create, brand with your information, and send out to you. So I mentioned the 12 topics for the price of 8. Also, for the month-to-month, I can offer you 100 off the starting kit price. That's normally $9.97, so that would be $8.97. And also $50 off your monthly reorder topics, which would bring that down to $4.47. That's normally $4.97. So before we get into the question and answer session today, I just want to leave you with this. Imagine your agency with a standing 45-minute presentation appointment every month with valuable referral sources. Imagine that your agency is the first to provide your community with value-added classes fully customized with your agency's contact information and branded company logo. This includes the giveaway flyers, the posters, postcards, informative brochures, and even the pop-up screen, the customized multi-use pop-up screen. And you can start to create your blue ocean strategy, get out of that messy water where everybody is just banging their head against the wall, saying the same sales message over and over. My contact information is here again. I can send you samples of anything you would like to see. If you will just email me at the address on the screen, or give me a call with any additional questions on anything that I have presented this afternoon. And what I'm going to do now is go over to my question box and see what I've got and start answering some of those. And again, those are to the right-hand side of your screen. There's a chat box. There's a question and answer box. Feel free to type in any questions you have, and I'm going to try to hit all of them today. I addressed this earlier, but just once again, there is a question on are any of the materials available in Spanish? And the question, or the answer to that is yes, we do produce these in Spanish. And I see I've got some sample requests that are coming up here now. I'll be sure to get those out to you. Again, the best way, if you do need to see samples of anything, is just to email me with the address that you want those going to. There is a question about can we customize the text on the materials? And the question is yes, you can. As I said in the beginning, if you can dream it up, we can create it for you. If there's some tweaks you need to make on the text, we can. Now, let me say this so I don't get tarred and feathered by my graphics department. It is a case-by-case basis on whether there would be any kind of additional mechanical time or cost associated with that. Sometimes there's not, though, if it's just a couple of tweaks here and there that need to be made. But we can certainly do any kind of additional customization on these or any of our materials. Question here about what was the best deal on the $997 package today. That is our startup kit if you were wanting to start by going month to month, and I'm just going to go back to it, and that's $100 off, which is normally $997, so it is $897. And I can offer, the exclusive offer is good for 30 days. I don't think I had mentioned that. Should a community education event last approximately 1 hour, or what do you recommend? Well, I mean, I think it would vary. The main thing you would want to do there is to have the seniors, again, involved in giving you some feedback, and I think maybe more of like a 30, 45-minute community education event would be fine. But if you've got them rolling and telling stories and asking questions, keep it going. But once you maybe find that the interaction has died down a little bit, then it's probably time to wrap it up on the actual presentation. There's a question here about the buyer of our non-medical home care services is almost always the adult daughter for one of their parents. How does your targeting of the senior affect this buyer if they're not there? Well, that's really where the marketing collateral comes through and is able to reinforce that message, because what we've seen, especially like we were talking about with the flyers and those becoming collector's items, they end up hanging up on the fridge in the senior's apartment. That's a way there for them to pass that information along to their daughter or their adult child. So I think really that is where having that marketing collateral that's reinforcing your message and what you're doing, that's also branded with your agency's information on there, can help you reach those adult children who are involved in the process. There's a question about, will you receive the entire series if purchased at one time, or is the material sent out monthly even if the entire series is purchased? Usually when a client does want to order multiple topics at once or order them in bulk, we do produce them all and send them out at once to the client. There's a question about how do you draw the audience. I've found that my presentations don't usually draw a large audience, then I feel it's almost not worth it. Well, I think two things here. Number one, it's certainly about what kind of promotion and exposure are you doing beforehand to essentially advertise your presentation. I mean, we talked a lot about the posters being the billboard there, the postcards as well. Although, I know those had more of an effect on the referral sources or being more effective to send to them. But yeah, certainly, I think increasing the level of advertising that you're doing beforehand for these presentations, but also is doing them on a regular basis. Because if you're coming in there and they're enjoying what you're talking about, which I'm sure they will, they'll start to tell their friends. I mean, I know that my grandmother is at an ALF, and she has like wine and cheese with her friends every day at 4 o'clock, and they just talk and talk and talk. We call them the Golden Girls. So I think that word will spread as long as you're doing this on a regular basis. Just a couple of quick notes here about will you email us a copy of your presentation slides? Certainly I will. And I believe that we are going to send out a follow-up email with a link to where you can download these slides like we've done with all of our webinar series. And then someone has asked to see the page again with the upcoming webinars, so let me just get back to that real quick. There's a question here about getting more referrals from an ortho office. And how the nurses have a great relationship with this agency, but the doctor does not want to send the referrals over since he's got an agency he's got a good relationship with. One of the things that I didn't really spend a lot of time on today is, again, we have the home care coaches on staff, and one of the things that we offer to any potential client out there that would like to try out our coaching services is a free coaching session. And I mention this because I know that our home care coaches on staff have some great ways, especially through developing a specialty program that you could market to this ortho office or kind of break the door down to the doctor. You do need to go back to he or she to do this, because it sounds like you're not getting too far with just the nurses, even though they love you. But back to the coaching call is that they can certainly help you with starting some ideas, like developing a specialty program that you can market to them that's maybe going to help differentiate you, in some ways you can possibly use outcomes to show that even the agency he's providing now is not really the best, and developing a brag book, which is part of the process of a sales call. If you are interested in the coaching call, and I hope all of you are, because it is completely free, please give me a call or shoot me an email, and I always will set up a time for you to spend about 30-45 minutes with a coach. There is one more question I want to address here. That is, will you sell the marketing kit itself alone, and what is the price? We don't sell individual components of the education series, so it comes as one package together. So again, just going back to the startup kit, it would be everything you see on your screen here for the initial kit, and then for the reorder topics. But no, we do not sell the marketing kit by itself. Okay, well, it's already after 2 o'clock, so I'm going to go ahead and wrap this up, and I think I have covered all the questions. If not, or if you think of something after we leave the presentation today, I'm going to leave my contact information up on the screen for you for a little while here. I hope to hear from you all. Again, I'd love to send you some samples or set you up with a coaching call or get you going on that blue ocean marketing strategy to have you doing something that's going to totally differentiate yourself from the competition and going directly to that senior. Because again, remember that voice preference trumps it all. So thanks so much. Hope to see you again next Tuesday. Have a great rest of the week, everybody.